So for this short clip, we're going to go over some of the important function of the first MPJ or metatarsophalangeal joint at the first ray here. Some things here that we've discovered that really aren't really well known is really how do you establish the tripod of the foot between the heel, the lateral aspect of the tripod, and the medial aspect of the tripod, which is the head of the fifth and the head of the first. There's a foot deformity referred to as a forefoot deformity, and the forefoot deformity, called a varus deformity, is a foot that actually, in order to find the tripod, they have to bring the whole leg in order to get this first knuckle down. And so what happens is they end up pronating excessively. These are the patients that can generate a bunion as well. And an athlete like this gentleman, it can be a serious power leak into not finding that first met, because instead of putting the foot down and coming straight over the foot forward in a sagittal progression forward, they spend time coming in medially. And that's a bit of a power leak for them. Quite frequently you see these athletes, they'll turn their feet out and be a little more duck-footed to try and find that first metatarsal, or the first aspect of the tripod, a little more effectively. So let's go over a few things and you're going to understand why this forefoot varus problem, or inability, let's just put it this way, an inability to find this medial tripod is really important. So there are four muscles that are important here. There's the long extensor. You just pan over here so you can see from the angle. So there's the long extensor, which is your extensor hallucis longus. There is your short extensor, which is your extensor hallucis brevis. There is your flexor hallucis longus, and then there's your flexor hallucis brevis. Okay. And each one of those, you can see, performs a different function: longus, brevis, longus, and brevis. Okay. Now, the important thing is to see this from a bird's eye view, to see what I consider to be one of the most important ones is the extensor digitorum, or extensor hallucis brevis, which comes off of this back aspect of the foot, this soft tissue, which is the short extensor group, extensor digitorum brevis, and at the top part is going to be your extensor hallucis brevis. And this causes what we call a claw-toed position, which readies the foot. So let's get a camera shot right from the front here, and I'll show you what happens when someone fires both the extensor brevis and longus together, but mostly the extensor brevis. If you're firing just the longus, you can see that the position, or the prominence of this first met head in plantar flexion is fairly pronounced and available to lock down that medial tripod. But when we go into the extensor brevis, you can see that it's more pronounced. And so they will find that tripod earlier. So what your athlete needs to be able to do is get into their extensor group, and during the swing phase, extensor longus will activate. And then once they get into this position, right before as they're progressing from the outside of the foot and progressing over to the medial aspect of the foot, the extensor hallucis brevis has to fire. That approximates the first met onto the ground, and now they can then go into their brevis, flexor brevis and longus, and post the foot up onto the ground here. Certainly without the clawed positioning here, that's habit and needs to be driven neurologically. But so what we're trying to do is get away from those clients who do not have enough extensor hallucis function to make this pronounced. A lot of people will have a little less function. You can see when I take away some of the extension, this isn't as prominent, and so you have to roll further to get that first met down. Whereas if I make the extensors more prominent, and even into the brevis joint, there you go, and then come down, that's as far as that tripod goes. Now his toe can come down with a sagittal progression. No medial internal tibial spinning, reducing tib posterior tendinitis, reducing splay of the arch and plantar fascial problems, metatarsalgia, etc. So this is our brief synopsis on forefoot varus, inability to stabilize the first met, and why. Because most people can't find the extensor hallucis brevis. Test it on your patient, hold that position right there. They should be able to hold that position. A lot of patients cannot even find that position, let alone hold it with strength.
When you see that